Hello everyone, I'm Sanchika. I'm from ECHO. A very warm welcome to all the participants and our subject matter experts for this session today, which is organized in collaboration with Sipher, RCTC, and ECHO India. The webinar topic is on good and replicable and innovative practices of tobacco control in India, and today's topic is regulation to curb tobacco exposure in movies. Our subject matter expert is Dr. Tina Rawal, who is a research scientist and associated with PHFI. She, ma'am, will be presenting on behalf of Dr. Monika Arora, who is Vice President of Research and Health Promotion at PHFI. Now we'll hand over to Arun sir for the introduction and opening remarks.
Thank you, Dr. Sanchika. A very good afternoon to all of you who have participated so far. First of all, I would like to, on behalf of all the organizers and all the participants, because today is a very special day, apart from the Valentine Day and the Sant Panchami, we have our Pulwama attack condolences to our martyrs. We salute to our brave soldiers who died in Pulwama attack on 14th February 2019. We are always grateful for their bravery and sacrifices. Their sacrifices will never be forgotten. Next. So, on behalf of the organizers, Sipher, Resource Center for Tobacco Control, PGMR Chandigarh, and ECHO India, I'm really delighted to extend a very warm welcome to Speaker of the Day, Dr. Tina Rawal, who is a young scientist and from the Public Health Foundation of India. She'll be presenting today's topic on behalf of Dr. Monika Arora, who is the Vice President, Research and Health Promotion at the Public Health Foundation of India. I also extend a very warm welcome to Dr. Rakesh Gupta, Dr. Sanchika Gupta, ECHO India, and Mr. Rajiv Chaudhary. My special thanks, very warm welcome to Dr. Rakesh Gupta and Dr. Aruna, Dr. Sujane, Dr. Siddhi, and Dr. Jaswinder, who have always been a part of this seminar or these webinars, in spite of their very, very busy schedule with their own activities and with their own work.
And so Dr. Ram Prasad is also with us.
Okay, he has joined. Okay, so also to Dr. Ram Prasad. Thank you, all of you, sir, for being the madam and sir for being a part of the webinars on every fortnight, and so that it encourages us and really give us impetus to hold such seminars and webinars on the different topics related to the tobacco control. I also extend a very warm welcome to all the esteemed participants who have joined. So with this, now I hand over to Dr. Rakesh Gupta, President Sipher, for introducing our speaker of the day.
So thank you, Arunji. And we welcome Dr. Tina Rawal, as already told that she's a research scientist with PHFI. Dr. Tina Rawal is a trained nutritionist and has a special interest in lifestyle-related non-communicable diseases and its associated risk factor research. Her particular research interest lies in the field of diet and physical activity, which are vital for the prevention of control of all kinds of NCDs. She has an experience of 12 years in the field of nutrition, and public health includes association with various research and programs focused on the prevention and management of the NCDs. She has been associated with HRIDAY since 2008 and is involved in the designing and implementation of the research studies focused on NCDs prevention and management, engaged in programs promoting health awareness and informed health activities. And she contributed as a member of the National Technical Working Group on developing this school health curriculum under the Ayushman Bharat, formed by the Ministry of Health and Family Welfare and the Ministry of HRD, Government of India. Tina also served as a member of the Children Nutrition and Diabetes Working Group under the Kids and Diabetes in School project, the International Diabetes Federation, and member of the Youth Advisory Group for the UN Asia Pacific Report on Youth. So you are welcome, Dr. Tina, and we are waiting for your presentation, please.
Thank you so much for giving such an warm introduction and giving this opportunity to share my experience of working in this space. So I'll be sharing my screen and just if this is visible.
अच्छा वो ना जो मेरे साथ ही ड्रॉअर है ना उसे ऊपर ही पड़ा हुआ है चेक
yeah, so maybe just to start this, I hope my screen is visible.
Yes, ma'am.
Yeah, it is visible. Yeah.
Slideshow.
Thank you so much. So just to start with, welcome to all the Sipher Eco India webinar on good, replicable and innovative practices for tobacco control in India. I'm presenting this on behalf of Dr. Monika Arora, as has been mentioned already in the initial talk. And today's topic is regulation to curb tobacco exposure in movies. Globally, tobacco use continues to be the leading cause of preventable death, and developing countries like India are no exception. Annually, tobacco accounts for nearly 1.35 billion deaths in India. And according to Global Adult Tobacco Survey, almost 267 million adults, that is above 15 years of age, are tobacco users. Many factors, both independently and in combination, plays a crucial role in influencing tobacco initiation, especially among adolescents and youth. And the key social environmental factors include normative expectation, role models, media, advertising, social norms, accessibility, policy issues, and influence of family members and friends engaged in tobacco use. Evidence suggests that the exposure of smoking in movies causes adolescents to initiate and continue use of smoking in India, the world's largest producer of movies, and produces more than 1,000 movies a year that's in several different languages in India. As an initial evidence, a cross-sectional study was conducted in 2009 to determine whether adolescents were exposed to these risk factors and whether such exposures was associated with tobacco use. And 12 randomly selected senior secondary schools in New Delhi were involved in this study, and more than 3,900 of adolescents from grade 8th and 9th were recruited, where the content analysis of 59 movies released between 2006 and 8 was undertaken, based on the top grossing 15 movies per year and 5 movies per year known to contain tobacco use occurrences. And students were asked whether they had seen these movies, their exposures to tobacco use occurrences, as well as their tobacco use status was assessed. Even after adjusting the covariates, the results have shown that those students with the highest exposure were at more than double the risk of being ever tobacco users as compared to those with the lowest exposure with the dose response relationship. And a similar relationship was existed between the receptivity to tobacco promotion and ever tobacco use. Similar findings were also shown in other evidences globally also. India accounts for nearly 27% of global film production by volume, and India is the world's largest producer of movies in several different languages. And Bollywood represents the Hindi movie industry, about 25% of total movie production in India. In terms of the 4 critical issues which are pertaining to the tobacco use in movie, that includes when tobacco use in the movies or the television is portrayed as fun, exciting, rebellious, or connected to wealth and power. It reinforces common advertising themes of the tobacco use. And such portrayal encourages tobacco use, especially among young people. The extensive tobacco use in movies and television suggests that the tobacco use is more common in society than it actually is. When tobacco use is viewed as a societal norms, it implies that tobacco use is acceptable and is another factor in encouraging young people to use tobacco. Star power sell movies, and the more popular the actor and actress, the more people likely to see movies and higher the box office returns. Star power can also sell tobacco use. When leading actors use tobacco or make anti-tobacco statements, it sends a powerful message to young people about tobacco use. Tremendous strides have been made to protect the health of non-smokers from environmental tobacco smokes, where actors light up in the movies or the television can impact efforts to reduce the harmful impacts of secondhand smoke also. In terms of the history and the rules prohibiting tobacco use in movies started from 2005. That includes a blanket ban on promotion and advertising of tobacco products through movies. But the rules were challenged in Mumbai High Court by the Bollywood film producer. In 2006, the Ministry of Information Broadcasting recommended that the tobacco use be allowed in the films where it is a creative justification for the same is needed. In 2009, there was a blanket ban again stuck by the High Court in 2009. 2011, the Ministry of Health and Family Welfare and the Ministry of Information Broadcasting mutually agreed upon new rules which were notified in October 2011. India is the first country in the world to have implemented comprehensive tobacco-free films, tobacco TV rules going beyond Article 13 of the WHO Framework Convention of Tobacco Control. Additionally, it has COTPA Section 5, which bans on advertising, promotion, and sponsorship of tobacco products. Indian tobacco film and TV rules were implemented in 2012, addressed the challenge of change in advertising and marketing tactics after COTPA implementation. It prohibits and reduces tobacco use exposure on screen. Violations that includes such as cancellation and suspension of license by the authority. All films containing tobacco imagery to provide a strong editorial justification for the display of the same as per the Central Board of Film Certification. And if the tobacco imagery is shown, film are required to display prominent anti-tobacco static warnings at the bottom of the screen during the period of tobacco display. There should be a display of anti-tobacco health spots for 30 seconds and provide an audio-visual disclaimer on the ill effects of tobacco use with a minimum 20 seconds duration each at the beginning and middle of the film. The salient features of the tobacco-free films and the TV rules in India includes, as we all mentioned, mentioned in the earlier slide, that all films containing tobacco imagery need a strong justification. Screen anti-tobacco health spots of a minimum 30 seconds duration at the beginning, middle of the film or the television program which displays the tobacco use products. Screen anti-tobacco health warning as a prominent static warning, which includes messaging like smoking causes cancer or smoking kills for smoking forms of tobacco use. Tobacco causes cancer or tobacco kills for chewing and other forms of tobacco. Warning written in black font on a white background. There should not be a display of brands of cigarettes or tobacco products on any forms of tobacco placements. There should not be a close-up of tobacco products, tobacco product packages. Such scenes are to be masked, blurred by the producer, distributor, and broadcaster while screening. To assess the effect of the rules, we studied the tobacco depiction in top-grossing Bollywood movies released between 2006 and 2017. And the rule compliance after 2012. The tobacco incidents and the brand appearances were coded in 240 top-grossing Bollywood films between 2006 and 2017 using a Breathe California method. 45 films were U-rated, that is applicable for all the age groups. 162 were UA rated, that is below the age of 12 years and must be adult accompanied, and 33 were A-rated. Before the implementation of the rules, as the graph shown, the trend before the implementation of 2012 rules and after the implementation of the rules till the year 2017. The results have shown that the number of tobacco incidents per film was increasing by a factor of 1.1 per year. However, beginning year of 2013, the number of incidents per film started falling significantly by a factor of 0.7% per year compared with the previous increasing trend. The percentage of youth-rated U and UA films with any tobacco incidents also declined from a peak of 76% in 2012 to 35% in 2017. The percentage of the films complying with the rules, which includes audiovisual disclaimers, health spots, and static warning, did not change significantly from 2012 to 2017. As we all know, the new emerging over-the-top platforms gain significant traction among Indian audiences, particularly adolescents and young adults. As the viewership of OTT has scaled up at an extremely high rates in India because of the sharp decrease in web cost, enhanced network, and stronger internet connectivity, accessibility of multilingual, multi-regional content, and the lockdown, which is because of the COVID-19 pandemic. And the OTT audience universe in India was at 423.8 million people in 2022, which was like increased 20%, that is from 353 million in 2021. And in India, the OTT user base was dominated and is being dominated by Disney Plus, Hotstar, Amazon Prime Video, Netflix, and other OTT player as well. Tobacco smoking, e-cigarette use is highly glamorized in movies during young generation to initiate and use tobacco products. Therefore, a study was conducted and looking at considering the inconsistent implementation of rules for films and TV programs, increasing trend in the subscription to the on-demand streaming platforms, increasing popularity of online videos and TV series. A study was conducted in 2018 where we have assessed the tobacco imagery in on-demand streaming series among popular urban Indian adolescents and young adults, and to assess the compliance of the content shown on this online series with tobacco-free films and TV rules in India. And the methodology included a cross-sectional descriptive assessment of a tobacco imagery on this online series. And the study period, as I mentioned, is from 2016 to 2018. The top popular series was selected based on the focus group discussions with adolescents between the age group of 15 and 24, and the study was implemented and conducted in collaboration with WHO Country Office for India and UCS. In terms of the methodology and the flow of the activities, what has been done is included the focus group discussions to select the most frequently watched online films and the movies. The pre-listing technique was used during the focus group discussions. 10 online movies in the series were listed, which included 188 episodes in total. 2 coders provided a full-time trainings to code the content using a Brick California method. And the data was analyzed using the information based on the depiction of tobacco brands, whether directly or in some other forms, episodes, age rating, presence of anti-tobacco static warning at the bottom of the screen during the display, anti-tobacco health spots displayed for 30 seconds, display of tobacco products, brands, if it has been marked I mask or blurred, and the presence of audiovisual disclaimer for 20 seconds about the ill effects of tobacco use. And the results have shown that across 10 series, there were 188 episodes on Netflix, and the most prominent platforms were Netflix and Amazon Prime. 7 series were rated age 16 plus, 2 were 18 plus, and 1 was 13 plus. And the median number of tobacco incidents per episode in foreign productions, for example, Amazon's The Marvelous Mrs. Maisel and Netflix The Crown, were higher than the Indian production Netflix Sacred Games and Amazon, which is like Mirzapur. And the tobacco incidents per hour ranged from 0 to 106.1, that is in Bodyguard, Riverdale, 13 Reasons Why, and The Marvelous Mrs. Maisel. In terms of the tobacco brands that is shown, that was shown in online series, that included 4 times in Marvelous Mrs. Maisel, 21 times in the series called Stranger Things, 35 times in Narcos, and 1 time in 13 Reasons Why. In terms of the compliance with the tobacco-free films and TV rules, 7 of the 10 series had tobacco imagery, and none were compliant with the rules. And contrary to the Section 5 of India's Cigarette and Other Tobacco Product Act, its rules were not complied with the streaming platform. And the results have shown that US-produced streaming media contains more tobacco incidents than India-produced media. In terms of the results, which has been highlighted in terms of the tobacco incidents, in 2023, there is a notification mandating the anti-tobacco warning for OTT streaming platform were notified, emphasizing the urgent need for stronger regulatory measures regarding tobacco depiction on streaming content. The new rules were scheduled to be effective from September 2023. The importance of regulations become evident as they can effectively reduce the influence of tobacco imagery portrayal on children and adolescents. A study has conducted to assess the frequency of tobacco depiction trend analysis in the depiction of tobacco imagery and compliance with regulation on the OTT platform before the rules took into effect, that is in 2023. The methodology was the same. Focus group discussions were conducted to shortlist the top popular 10 films and 8 series among adolescents and college students. Based on the focus group discussions, the listing were done and the content coding based on the Breathe California method was adopted and the content analysis was done. 3 of the 8 series were rated 16 plus, 4 were 18 plus, and 1 was 13 plus. The table which you are looking at right now at the slides, these are the preliminary tables and yet in the further analysis phase. 5 of the 8 series had tobacco incidents ranging from 8 in The Witcher and 238 in the series called Saas Bahu or Flamingo. The Indian web series Saas Bahu or Flamingo had the highest median tobacco incidence, that is 33 per episodes, and higher incident rate, that is 36.7 compared to the international series like Citadel and The Witcher. The Indian series shows 490 tobacco incidents versus 27 in the international series. Similarly, 10 top films which were shortlisted based on the discussions with adolescents. 6 of the 10 films were UA rated, 1 film was A rated, and 3 were 13 plus. In films, 4 of 10 films had tobacco incidents ranging from 11 to 36 in Extraction 2, Murder Mystery 2. International production films had 47 tobacco incidents, while Indian film portrayed 38, which was very different from the series. The scenario for the films is different from the series. In terms of looking at the comprehensive coding of web series was conducted to track tobacco incidents from the year 2015 to 2023. And the table which you are looking at the slide, the number of series varied across the years, with the highest number in the years 2017, 2018, and 2023. And Netflix emerged as the primary platform, streaming the highest number of series among the total of 26 series, that is between years 2015 to 2023. In 2023, out of 4 youth-rated series, 1 had tobacco incident, resulting in a mean of 4.75 tobacco incidents per youth-rated series. And the adult-rated series, the highest number of tobacco incidents were reported in 2017, followed by 2016, and then in 2023. There are other studies which has done internationally and aimed to determine the extent of e-cigarette related to imagery and dialogue in Netflix content popular among the young adults. And the methodology, based on the methodology that has been used earlier, the study documented e-cigarette imagery found on Netflix and demonstrates the need for a health communication campaign e-cigarette use, particularly among susceptible populations such as young adults. In terms of a summary, there is a need for a better enforcement and strengthening of Section 5 of HOTPA. The production houses and filmmakers must be sensitized about the issues, exercise accountability towards the youth of India. There is a need to enhance monitoring implementation of the rules by government agencies, and there is a need for an update on WHO Framework Convention on Tobacco Control Article 13 guidelines need for strengthening regulatory enforcement measures related to depiction of tobacco imagery on on-demand streaming platform, monitoring of the depiction of tobacco in entertainment media, and there is a need for implementing a comprehensive ban on taps. Thank you very much, and I'm there to answer any of the queries.
And thank you, Dr. Tina, for a wonderful presentation. And we must thank PHFI for this evidences they have produced in favor of film and television rules and the OTT notifications. And it is also a matter of pride for all of us, especially in tobacco control, because anywhere in the world, I think India is the first country to introduce film and television rules, which were implemented in 2012, and also introduce notification against tobacco depiction OTT platform.
Yes.
That was it was implemented in September 2023. And incidentally, Sipher, they held the last workshop on 20th of April 2023 before this notification was done. So it was supported by WHO Southeast Asia for Sipher. So I think it is a matter of pride for all of us. And as per the evidence produced by PHFI, it is for sure that watching tobacco in the movies is associated with its use amongst the youth, especially in the urban area. That is for sure. And it is very surprising that 27% of the global film production that is from India. So that is, I think, a big chunk of movies we are producing. And she also emphasized on the 4 critical issues that how tobacco use is portrayed and the amount of tobacco use and who uses tobacco. I mean, the higher the value of the celebrity, the higher the tobacco use. I mean, the youth are attracted for the tobacco use. When the tobacco is used, where the tobacco is used, in fact. Like the Shah Rukh Khan was shown as smoking and during the cricket match. So these are all very important issues. Tobacco-free movies and TV rules, so they were introduced in 2011, but they were implemented in 2012. And the lastly, she summarized what has already been done and what needs to be. So thanks a lot, Dr. Tina. I think we must ask Dr. Rakesh Gupta for his comments. Dr. Rakesh Gupta, Dr. Ram Prasad, Dr. Siddhi is with us, Dr. Aruna is with us, and Dr. Jaswinder is with us. So anyone can just give their comments, and they can also pose questions for Dr. Tina. So first, we'll start with Dr. Rakesh Gupta from Jaipur. Thank you. So, Dr. Rakesh Gupta, are you with us? So we can start with Dr. Ram Prasad. Maybe Dr. Rakesh Gupta is not able to listen to us.
Yeah, thank you, sir. Thank you, Dr. Tina. It was definitely an insightful session. I just had one request. I don't know whether it can be implemented or not. But before these particular certifications are given for both regional movies, documentaries, TV serials, is there a mandate check which has to be compulsorily implemented before they can actually screen it? Because can it be universally applied without any, in the sense there shouldn't be any anybody left out of this particular rule, in the sense whether it's a Bollywood movie or any movie, any documentary being made for viewing across any ages, can it be compulsorily implemented? Can we actually have a universal certifying authority as well as a certificate which has to be compulsory cleared by all movie makers, documentary makers, serial makers, television, across all channels? Is it feasible and possible? Just one particular point and a very relevant one, I thought. So just your insights and thoughts on that, please.
Absolutely, Dr. Ram Prasad. I think very, very important and need to be strengthened. So that's what we are trying, because that's what we have initiated with the Bollywood movies, which is most popular. Because as per the COTPA 5 section, there has to be a restriction of tobacco usage in all the entertainment and all the media spaces. So that's what we are trying to say, and we are emphasizing as a group that there is a need for strengthening for the monitoring, especially if the implementations are there, but there has to be a monitoring aspect need to be included as the mechanism which will be needed for the restriction of this tobacco depiction, especially in the media channels.
Yeah, no, what I'm trying to say is if it is mandatorily made as a part of the process itself, the end process, there has to be a stringent check. And in case there are violations, it should not be released to any public, whether it is children, adults, old adults, military, whatever it is, that it shouldn't be released at all. I mean, that hard and fast rule, if it is implemented, I think it will definitely have a positive public health proactive measure. So it will be definitely have a lot of positive outcomes. But we see a lot of violations. See, depending upon the financial budget, depending upon the clout of the movie making community, or depending upon who the director is or which the directorial house is, these violations are seen. So now and then we see even huge billboards. There are violations. Regionally, I think it is seen more. Bollywood at least comes under the purview of the entire nation. So a lot of people are actually seeing it. But regionally, regional movies, when they are made, it is violated very often, and sometimes even we see violations on Netflix, television and all regularly. So such things, if before anything is made, like FSSAI is for food safety, just like that, if something is made for film safety, I'm just bringing up a term, that's all. Anything for film safety and viewing, I think it has to be certified. See, we don't consume anything which doesn't have an FSSAI seal. So just like that, we should not view anything which doesn't have a film safety rule. So that is what I'm just trying to brief. That can be implemented. I think that will be a great move and a very positive public health outcome. Just as such.
Agree.
I think the point is well taken, Dr. Ramprasad. So we already have a film censor board with us, and now the OTT notification is there, but surely the implementation of the notification is also not that good. Yes. But it is gradually moving, and some of our activists in the tobacco control, like Mr. Cyril Alexander, they are doing that PILs to get the notification implemented. So thanks a lot. And Dr. Rakesh Gupta, for your comments, please. I think we have lost connection. So, Dr. Aruna, any comments from your side?
Yeah, thanks a lot, Dr. Tina, for sharing your valuable inputs as well as the research which was done for the movies and tobacco regulation. Yeah, I have one query. See, like in the OTT platform and even in the movies, like the electronic nicotine delivery system, the vaping pens and the jewels have been portrayed like anything just as a stress buster as well as a style statement. So what are your take on this?
Absolutely agree with you, Dr. Aruna. And the way I think the recently conducted study which we have conducted at HRIDAY and in collaboration with WHO, they were surprisingly the initial, I think the results which we have conducted in 2018, there were international productions which have shown tobacco depiction as little more as compared to the Indian productions. But into 2023, the Indian productions are more than the international productions. So I think looking at the popularity among adolescents, among young people of this OTT stream platform and the easy accessibility that has really, I think, surpassed the rules and regulations. So I think it is much needed to monitor the regulations and what has been implemented already.
Yeah, because
but Dr. Tina, I must say that after that PICA 2019, I think because of that, depiction of electronic cigarettes especially is not that much in OTT platform, as well as in TV and serial, the film and TV serials also. So I think that is a positive thing about India, that they have very timely done this PICA 2019.
Yeah.
So especially still, like whenever they portray the elite class or a lawyer, a person who is a cop, just to stress buster, like the way like the combustion has shifted to now the vaping part, like.
Just wanted
but
to
Dr.
share.
Aruna, I will agree that it is more in international serials, so, and less in the Indian serials. So I think you'll agree with that. But I'm sure I agree with you that the implementation of OTT, that notification should also be very strict. Only then it can, the depiction of electronic cigarettes in addition to the tobacco production will be decreased. So thank
Especially
you,
the
Dr. Aruna. Yeah.
NRI characters, whenever they portray
Yeah,
in
yeah.
any of the movies, even in the regional movies like Kannada movies, like where I have seen, like
Yeah.
the light thing they show, like it is a novel product they've been using is the vaping
Yeah.
pill or like that they show. So.
Dr. Aruna, we should be thankful to Government of India for very timely that PICA 2019.
Yeah,
Otherwise,
2019.
I had a guest from UK. He was a third-year student MBBS, and he said that most of his friends, though he's a medico himself, third-year MBBS student, but most of his friends were using electronic cigarettes, and that was quite a lot. So he was very surprised to see very less smoking tobacco as well as electronic cigarettes in India. But in India, he couldn't see anyone smoking electronic cigarettes. So I think that is good that it has been timely banned in India. So now we have Dr. Dilip Acharya also with us. So any comments, Dr. Dilip?
First and foremost, sorry, I got a bit late in joining today, but I must say this is a very important topic, and the people do get, especially youngsters, do get motivated with this being depicted in the movies. And the line at the bottom now, the scenes have to go away rather than just a line now. So at least for the future movies which are coming up, the regulation should come that by and large should be avoided. So that should make out a good difference. But as you rightly said, PICA 2019 was very important for us.
Yeah.
Because in Jewel also, I told that almost from 10 to 20%, and almost 10% increase in 1 year in US.
Yeah.
For the used by the youngsters. It was a very timely thing done up. And I must compliment you people for doing a good job. Thank you very much.
And Dr. Dilip, is surprisingly only 33, maybe another 1 or 2 countries, they are comprehensively banning electronic cigarettes. Anywhere, only 33 countries in the world. And India is amongst them. So that is very important. And actually, we learned from US. Actually, I got it banned in Punjab way back in 2013. But I learned it from University of California, San Francisco. So they are still struggling how to prohibit or how to regulate the electronic cigarettes. They are still struggling with it. And you know about UK. UK, they have been promoting electronic cigarettes like anything.
They want to propagate it as a quitting device.
Yeah.
Quitting device. That's the main problem with us.
Yeah. So, and now we have Dr. Siddhi. Dr. Siddhi, do you have any comments?
Yes, sir. Apart from movies, during the match session, there will be cricket matches, the surrogate ads coming up. Even that part has to be controlled. So the law about that.
Yeah,
Plus
Dr. Siddhi,
also,
we are talking about the smoke-free movies now, the tobacco-free movies actually.
Yeah. Plus,
but definitely that is an important issue. Yeah.
Yeah.
That also is part of Section 5 of POTPA.
Right.
But we are not discussing about that in this presentation.
Plus, putting a scene deliberately and just adding a line, that should be stopped, and only the scene should be cut off properly. So if that can be made.
But Dr. Siddhi, there was so much of opposition from Bollywood producers.
Because of sponsorship.
So when we tried to impose the ban, so you may be knowing about that. I think it was Mahesh Bhatt. I think he very forcefully, he was very forceful in getting this ban, repealed.
So there will be placards, there will be some kind of billboards. Person traveling in other car might be using it.
Dr. Siddhi, actually, you may not be aware that for getting anything done against this tobacco industry is very, very challenging. And they are such a powerful lobby. So do we have Dr. Rakesh Gupta now? Anyone amongst the participants, they can ask questions from Dr. Tina. She is still available.
Yes.
Dr. Jaswinder, do you have any questions? Or anyone else?
Ma'am, this study it was
Dr.
done.
Jaswinder, you are muted. Dr. Jaswinder, you are muted, please. Yeah.
Sir, in very informative lecture, thanks a lot. I just want to correct myself, sir. In the last Zoom meeting, I am working in a tobacco cessation center at a dental college.
Yeah.
And in last meeting, you must remember, I informed that out of 100 patients, we could only find 2 patients of tobacco use disorders.
Okay.
No, I asked the postgraduate students of the surgery department, orofacial department, to screen the patient, and they have been able to find at least 8 to 10 patients per 100 patients.
So there is improvement in screening at least now.
No, sir. Actually, initially the screening was being done only by third-year students or interns only. No one is being done by the postgraduate students. So I want to
Dr.
correct
Jaswinder, which dental college you are working?
Sir, I am working at Amritsar Dental College. I am basically
Okay.
MD anesthesiologist, assistant professor.
Okay, that's great. So, any comments on the depiction of tobacco in movies or OTT platforms? Yeah, Dr. Siddhi.
About the studies shown by Madam. It was done earlier also in 2012 probably, and recently 2023 article was also there. So what difference did you find?
I think in 2023 it was related to OTT platforms, no? Am I right, Dr.
Yeah. So in terms of what you have asked, we have done the streaming platform study in 2016 and 18, and in 2023 again. And we have seen the trend analysis looking at the depiction of tobacco incidents on online platforms were significantly different. But the main difference was in 2018, the studies which we have conducted, I mean, the results which have shown more tobacco usage among the international production houses. But in 2023, the more tobacco incidents are like recorded in Indian production houses. So that's the major difference what we have seen in 2018 versus 2023.
Students' knowledge and everything, their awareness.
That we have not done yet, but we have done the content analysis of the online streaming platforms, which are available, like the series and the films which were released. And those were selected based on the discussions with adolescents.
So there's a question from Dr. Jaswinder. So Dr. Jaswinder, you can pose your question.
Sir, I'm just confused a little bit. In Punjab, you are aware that there is a huge problem of opiate use disorder, heroin disorder.
Yeah.
And the harm reduction theory in form of buprenorphine is considered, though I don't prescribe it, it is considered standard treatment. Then why not in tobacco use disorder, nicotine replacement therapy? Why it's not a standard treatment?
No, for tobacco cessation, bupropion is used and varenicline. So there are two products which are being used, but we never promote electronic cigarettes, but we are using NRT, bupropion, and varenicline.
Right, sir.
It is being used, yeah.
Okay, I will contact you, sir. I need a little more information. I will call you personally.
Sure.
Thank you, sir. Thank you.
Anytime, yeah. And if there are no more questions, then over to Mr. Arun Verma.
Sir, I would like
to
add a point to what sir had asked for obesity. So, for tobacco cessation, harm reduction part, like the electronic cigarettes were promoted as a harm reduction. But they are not risk free. But as far as the buprenorphine is concerned, the safety profile and the ceiling effect, the safety is established, and the harm reduction.
You are talking about buprenorphine?
Yeah. Okay. Yeah, buprenorphine for OST, opioid substitution treatment, as a harm reduction protocol. So there actually it fulfills the harm reduction criteria, because the person is shifting as far as the route of administration is concerned from IV route to the oral route.
Yeah.
Ma'am, I was asking about nicotine replacement therapy in form of gum lozenges spray.
Sir, they are all the cessation aids, no sir? They are all the cessation aids. So, but for the harm reduction part, even cutting down of a cigarette or cutting down of smokeless tobacco also is a part of harm reduction only we can consider as far as tobacco is concerned. Even the
But surely we don't promote electronic cigarettes as harm reduction, and there's no harm reduction in electronic cigarettes for sure, because electronic cigarettes, they are promoting dual usage, in fact.
Yes.
And there are too much harms related to cardiovascular issues, then there are pulmonary issues, mental issues, then, and even the batteries, they get burst, and there's accidental ingestion of
Physical
the
accidents.
e-liquids. So there's a lot of harms related to
And
electronics.
gateway
So
also.
it's nothing like electronics. Ajay?
And the gateway also.
Yeah, it is.
Starting this thing.
In any case, yeah, nicotine is a gateway to other addictions, surely. Any kind of nicotine, maybe
So
chemical
that's why,
or.
sir, like none of these products have established the safety profile as that of buprenorphine for OST.
Yeah.
So that's why, like,
I'm
it cannot.
sorry. I'm sorry to say, ma'am, I have 20-year experience in this field. In long run, buprenorphine is as dangerous as anything else.
Yeah.
After 6 months or 1 year, patients start getting the same effects, sexual disorders and dependence and all.
Erectile
It's
dysfunctions and
very
all.
difficult to taper it off.
Oh, yeah, actually, it is another addictive product, actually. If we use it regularly, surely.
Sir, good afternoon. Susan here.
Yeah, Susan, how are you? Yeah.
I'm good, sir. Very good afternoon.
Any
Sir,
comments?
I had a question for Madam Tina. We talking about OTT platforms, and this study is very interesting, very phenomenal, and important. We can quote. So my question was to her that can we somehow use this, or quote this when we want to address the advertisements done by film stars?
Susan, I think we missed you. And I may tell all that
Yes.
she's from Faith Foundation, Gujarat, and she's doing extremely good work in tobacco control. So over to Dr. Tina. So what is your question, Susan? Can you repeat
So my question is, can we use this study for, let's say, addressing the advertisements done by film stars and, prominent people? Because now we have also sportsmen using it. We have had Sunil Gavaskar. We are having a couple of other sports people also advertising. So can we use that some way to, address this issue also? The study,
Yeah, thank you so much, Susan, for this question and for this comment. So in terms of the publications, the earlier studies have already been published, which we have conducted before 2023. 2023 results are still analyzing, and we are just presenting the preliminary findings, what we have done recently. So this will be published soon, then it can be quoted. But before that, I think the earlier studies can be quoted, which we have, I think, published in 2021 and 2022. So yeah, the results and the publications are available. Happy to share those links.
Thank you. If you can just share the links as well. Thank you.
Thank you, Dr. Tina, for your answering all the queries. So over to Mr. Arun Verma for a formal vote of thanks. And it is very surprising that more than 50 people that joined for this session. I thought that only tobacco control people will be joining, but many others, they have actually joined. Yeah, thanks a lot.
Doctor, very important and relevant topic today.
Yeah.
It concerns our youth, our adolescents, as well as our female. Thank you on behalf of the organizers. I propose a vote of thanks to our speaker of the day, Dr. Tina Rawal, for making a very elaborate presentation with a lot of data and also satisfying each and every participants who have made some queries and questions to her. Thank you so much, Dr. Rawal, for giving a good presentation. I also convey our thanks to Dr. Aruna, Dr. Ram Prasad, Dr. Dilip Charya, Dr. Siddhi, Dr. Jaswinder, Dr. Rakesh Gupta, Dr. Sujan, and all the participants who have spared time to be part of this webinar. I also convey our thanks to Dr. Rakesh Gupta, our president of the Sipher, and Dr. Sanchya Gupta, and once again to all the participants. And have a good day and a happy Valentine and a happy Vasant Panchami to all of you. एक फोटो तो ले लेते हैं, फोटो.
Yeah, Dr. Sanchya, can all switch on their videos, please? So we can take a snapshot. Rubina, Susan, can you switch on the video? Chetna, Prema, Nirmala, Anita. Yeah. Yeah, Dr. Sanchika, can you take a snapshot, please? I think we have enough of for people opening up. Yeah. Thank you.
So thank you once again, and have a very good day. Have a good day.
Thank you. Namaskar.
Thank you so much. Thank you.
Jai Hind.
Jai Hind.